Is Prisco, is an ancient Roman name. Piscitelli is the surname. And usually I work starting from this principle. This is the precautionary principle. You know, we have this principle stated also at the Article 191 of the European treaties. So it is something which enables us not to do anything in case of risk, but when there is no certain risk, but just a probability of risk. The thing I was going to present and to represent to you is just one concept. Yeah, you know, we have a lot to do on air quality, but this one of our major field of interest. This is one of our studies we are making on Taranto City. I work as a vice president of the Italian Society of Environmental Medicine. I'm a medical doctor. I am an epidemiologist. But the thing we are working on is actually a call for a new vision of epidemiology and medicine that can change the world. This is a call that I would like to launch also today, because we have published this editorial starting from a concept that was really deemed, because in 1955, in the most known encyclopedic dictionary in Italy, it was clearly stated, incredibly, that, as you see, cancer is an occupational disease suffered by the workers of chemical industries. That means that it was clear at the time that there was a clear association between the cancer and exposure to chemicals. What happens? It happened. What is usually happening, that exposures that are limited on a very enclosed population, so working exposures, can become general population exposure, so can be generalized. And then we lost this kind of information. We started talking about the accumulation, gradual accumulation of random mutations, genetic mutations that day by day, year by year can accumulate. But this is something that we are not seeing anymore. So the facts, the observations, that means the truth. So epidemiologists really have the opportunity and the chance to work with the truth, no? Because we work with the observations. So if the observations, which represents the truth, the facts, are no more consistent with the major theory, we cannot change the facts. We have to start adapting maybe the theory, no? And we are working now on the epigenetic theory, no? Which means that we are all exposed to environmental treats that and environmental exposure and contaminants that to our cytoplasma can enter in our cells and interact with our epigenetic stuff. And this is something we have to take into consideration, because we have to do something in the view of primary prevention, no? We have been told that we have to expect cases, cancer cases in pediatric patients, so in children. It was something we were not used before. It was something that was not normal in the 50s, in the 60s. So it is something we have to think about and change our vision, because our goal as medical doctors, as community with taking care about planetary health, about One Health, which is a concept very connected to the planetary health, is let people do not become sick. Let vulnerable groups such as children not become sick. So this is true for cancer. This is true for many other conditions that can be linked to the exposure, for example, to 94 contaminants endocrine interference that there are present in amniotic liquid, for example. So that can influence the development of neurodevelopment conditions. Let's just think to the epidemic of autism or autoimmune disease that we are experiencing. The diabetes in young people that were representing 1%, now it is 10% of diabetes. We have to move into a new kind of vision of medicine and epidemiology, which is based on primary prevention. So thanks a lot, and we just mentioned that as Italian Society of Environmental Medicine, we have just promoted the opening of the SESMA, the Società Spagnola de Medicina Ambientale y Cambios Climáticos. We have here some people representing the society, also the Vice President, Andrea Falco, who came from Madrid with Jorge Barrios from the Council. I see also here Elena Codina. We work with WHO since a lot of time with Mariana Ira in this department, and we also promoted in the US a new network, which is called the Environmental Health Research Organization. We will be glad to be introduced to the Planetary Health Alliance. Thanks a lot. Thanks.
So the question goes as follows. You've succeeded, okay? You've managed to implement planetary health training across the US, and this started today, and we're 10 years in the future. And every single medical professional is now implementing this in the way they work. How does this look like? What has changed as a result of this? What do you see?
So from one side, all these speaking about planetary health, One Health, and environmental health is producing some results, at least in the awareness of people like you and like even very young people that really put this as a priority. For example, we had European elections in this the last weekend. Even 50% of people did not go to vote, but really a lot of people and young people, even a lot of people who did not vote, who I spoke with, they were willing to put this as a priority, this point as priority. So this is the first result, because it was not like that in the generation of your father or my father. This is the first result. The second result is that we are doing something. No, as Chris was saying, he was speaking about the in the United States from his observatory of John Hopkins, about the mess of our healthcare systems all over the world. Healthcare systems are producing a lot of pollution. They are one of the not say the primary source of pollution, but you know, a lot, really a lot. We recently published a study with SIMA, along with the new dean of the Harvard School of Public Health in last November, about the impact, negative impact of healthcare system on the environment. Something is going to be done. There are a lot of projects to reduce these impacts, both in the energy consumption, waste production, waste management. It was not a problem, not even addressed, not even perceived as a problem some years ago. Do you agree, Chris, from there? And on the other hand, when we speak about, for example, One Health, antimicrobial resistance, our colleague from Portugal was speaking about antimicrobial resistance. She's a veterinary doctor also, so, but also a medical doctor, a GP. So she is the personification of the One Health. No. She can become the testimonial for Jordi of the One Health. But I have the impression, I don't know if at WHO level this is perceived, I have the impression that even when I participate to the European Commission conferences of One Health, that there is a lot of speaking about One Health, and even a lot of speaking about planetary health. I participated into some Lancet conference on planetary health. But then the actions that we make on that are very low. Yeah, a lot of things can be done more and more, but some results are being accomplished, not at the rhythm that we would need to cope with these problems.